I'm Darren Cava-McCauley, DO, founder and Chief Executive Officer of Concierge Medical Cannabis. Today we're going to have a discussion about cannabis and chronic pain, because cannabis can be used as a therapy for pain by treating the mind, body, and spirit. Pain that persists for more than 3 months is termed to be chronic pain. 20% of the population in North America will suffer from a form of chronic pain in any given year. Chronic pain has an enormous impact, not just on an individual patient, but on society as a whole, as a major cause of absenteeism and decreased work potential, and as a significant use of medical care, including therapies that are known to have inherent risks, such as the prescription of chronic opioids. Cannabis has been used for the treatment of pain for over 4,000 years. Musculoskeletal pain, menstrual pain, abdominal pain, and pain from nerve damage are all common examples. This is in addition to other symptoms of disorders that frequently cause pain, such as the swelling or stiffness associated with arthritis. Pain management is the #1 reason why patients seek medicinal cannabis. The pain-relieving effects of cannabis have been studied for years and are supported by over 300 studies and more than 30 of the gold standard placebo-controlled double-blind randomized trials. Cannabinoids affect pain by mediating both ascending and descending pathways in the central nervous system, decreasing nerve excitation, promoting a decrease in inflammation, and decreasing the cognitive awareness of pain. The type of pain matters, and our discussion will focus on the following: neuropathic pain, resulting from disruption in structure or function of nerves; nociceptive pain, resulting from tissue destruction and inflammation; nociplastic pain, resulting from an aberrant perception of pain in the central nervous system. Cancer pain will be addressed in another session. THC facilitates the release of dopamine, the nervous system's pleasure and reward chemical. THC inhibits the release of glutamate and serotonin. Glutamate is the primary excitatory neurotransmitter, leading to nervous system cascade and propagation of nerve signals. Chronic pain causes serotonin to be released into the spinal cord, where it facilitates the release of substance P, the spinal cord's pain mediator, and can cause non-painful stimuli to be perceived as painful. With the release of glutamate and serotonin by chronic pain, it becomes a self-fulfilling prophecy or a positive feedback loop, where pain begets more pain. THC decreases afferent or towards the brain pain signaling by greater than 50% in mammal models. CBD decreases reactive oxygen species and thus has a role in decreasing inflammation. CBD enhances adenosine receptor signaling, which can lead to the decrease in pain signaling without the actual application of adenosine itself, which can cause the perception of ischemic pain. CBD plays a role both as an anti-inflammatory and signaling mediator that has somatic, body, peripheral, nerve, and central mind effects. An understanding of the physiologic effects of THC and CBD on pain modulation and propagation opened the door for their use in treatment of nociceptive, neuropathic, and nociplastic pain. A common theme in dosing of medical cannabis, reflected in its use to treat pain, is to use CBD not only for its direct effects, but to mitigate the effects and side effects of THC. Although THC has been shown to reduce mechanical pain perception by slowing afferent nociception, signaling from the body to the mind, and to decrease glutamate and serotonin release, use of THC for a prolonged period at high doses may lead to tolerance and have the opposite effect on the nervous system by causing the endocannabinoid system to downregulate. Therefore, using lower dose THC and higher concentrations of CBD allows the CBD to bind to CB1 receptors in addition to its preferential binding of CB2 receptors, decreasing the side effects of THC and the deleterious effects on the endocannabinoid system over time. We've outlined how pain can become a feedback loop that worsens, with pain priming the nerves in the mind to feel more pain in the future. Cannabinoids can be a part of breaking that cycle and giving patients the ability to utilize other therapies. Endocannabinoid dysfunction has been postulated as the root cause for several disease states, including irritable bowel syndrome, chronic migraine, and fibromyalgia. Fibromyalgia is a disease primarily characterized by the chronic and total body perception of excruciating pain to stimuli that are not otherwise painful. Fibromyalgia patients also complain of a vast array of other symptoms from abdominal discomfort, fatigue, blurry vision, anxiety, and sleep disturbances. Although more research is needed, preliminary trials show that cannabinoids can be extremely effective in mitigating the symptoms of fibromyalgia. Adverse events and side effects can be greatly reduced by appropriate dosing and careful attention to the components given in a given preparation. Cannabinoids may be a useful adjunct that gives fibromyalgia patients a window to take part in other therapies that can support the endocannabinoid system, which might not otherwise be tolerated, such as exercise. Thank you for joining me in this discussion of cannabis and chronic pain. Remember, cannabinoids have been extensively studied and their application in the use of chronic pain has been used for years. They can be used safely over time, especially if both CBD and THC are used. I'm Dr. Darren Kaba-McCauley from Concierge Medical Cannabis. I hope you join us again soon.